Family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight, we're going to talk about diabetes and help you with your holiday diet. We've got healthcare Christmas gift ideas brought to you by Family Practice Associates of Lexington, and the top plastic surgeons in Lexington are here. And the Salvation Army helps us to give during the holidays. My first guest, Dr. Kyle Rosenstein, you're an endocrinologist at Baptist Health Lexington.
That's right.
Yeah. One of the things you do a lot is diabetes, and we talk about diabetes, and we've talked about it a lot on this show. But maybe we ought to get back to basics and just tell us what makes the diagnosis of diabetes?
Yeah, sure. So I guess there's a couple forms of diabetes that we think of. There's type 2, type 1, and gestational, which are the three main categories. And overall, diabetes is going to be the inability to take the sugar in our blood that gets there either through our diet or production through our liver and properly utilize it. There's several ways that we diagnose it. Most commonly, at your primary care doctor's office, they may run a test called a hemoglobin A1C, which is an indirect measurement of the sugar level in your blood. And if your hemoglobin A1C is at 6.5% or above, that would make the diagnosis. But then the other tests are directly measuring your blood sugar through a fasting blood glucose or through a test called an oral glucose tolerance test. The last is not used as frequently in type 2 and type 1, but certainly in the gestational diabetes community, very common to see.
Gestational being pregnant?
Pregnant, yes.
Yeah. Now, is there a certain number you want your fasting to be, or does that really make any difference?
Well, certainly you want it to be less than 100. Anywhere between 100 and 125 would be considered impaired fasting glucose or pre-diabetes. And that would be an indication to start working on lifestyle modifications to try to lower that number. And then above 125 would be diagnostic for diabetes.
Now, you talked about pre-diabetes. Tell us a little bit about that.
Sure. So that's just the beginning signs of your inability to properly utilize the glucose in your blood system. And that would be a great opportunity for you to start working on lifestyle modification, whether that's through dietary changes, increased physical activity, or increased frequency of screening to make sure that you don't develop type 2 diabetes.
Okay. Now, in a little bit, we might talk about medicines or insulin later, but right now we're in the holidays.
Sure.
Everybody's eating, and everybody's eating a lot of stuff, including carbs and sugars. Is there anything you can do about your diet, or you just give up at the holidays?
No, I mean, absolutely you don't want to give up. I think it's a good opportunity to really think about prioritizing what foods are important to you and try to eat them in moderation. There are foods that we'd like for people to avoid, the simple sugars and carbohydrates that come in the desserts, the pies. Minimizing your alcohol intake certainly can be helpful. And then trying to keep your portion sizes overall to a reasonable amount. I think that, in addition with maintaining good physical activity during the holiday season, is a good way to start at least.
Now, I know the right answer, but are people who are going to cheat? Is that not a good thing? Do you take extra medicine? Do you stay on your diet? That's what everybody's going to be thinking about at the holidays.
Sure, and obviously talk to your physician first, because there's a lot of different treatments for diabetes at this time. Everything from lifestyle modification to fairly high doses of insulin, and so everyone's going to be a little bit different. What I would say is, if you're going to cheat, try to keep it to a very small portion of what you're going to cheat with. Try to get a little bit of physical activity, whether it's walking or something a little bit more vigorous after your meal. And then as soon as possible, try to get back to your normal healthy habits if possible. People do slip up, and it's important not to let that weigh too heavily on you. Just try to start fresh the next day.
And the reason is diabetes comes with a lot of complications. Just briefly tell us about some of those things.
Sure. I mean, the main thing is the cardiovascular complications. So you have an increased risk of heart disease, increased risk of kidney disease, typically anything that's affecting the small vessels in your body. So that's the small vessels behind your eyes, like diabetic retinopathy, the small vessels in your kidneys. So you have an increased risk of chronic kidney disease, and then the small vessels of your heart. So increased risk for heart attack.
Any holiday hacks you can do with food?
There's certainly some options that are better than others. I mean, I would say try not to go too long without eating, because I think people tend to fast in the morning to try to eat a larger meal in the evening. I think that doesn't work very well for most people because they tend to overeat. Prioritize eating some form of lean protein as your first food so that you're not eating the bad things first, and try to get a little bit more full that way. And then try to stick to some sort of regular physical activity. I mean, I think that's always a good thing to help for your health.
That's great information. We appreciate you coming in. Thanks so much.
Yeah, not a problem.
And this holiday, don't cheat. Follow your diet. Take your medicines. We'll be right back.